Quinton Lucas, Mayor of Kansas City. Thank you, Michael. I just have a few things that we wanted to discuss today. I'm joined as always by Dr. Rex Archer, our Director of Public Health, Councilman Kevin O'Neill. It's good to see you, and Dr. Erica Carney of our Emergency Medical Services. We've had a few questions in recent days on a number of different things. I will start with the first, which relates to parks, park space, what folks have been doing. As you all know, our parks remain open in Kansas City, and we encourage, if you are at our parks, to maintain social distancing, among other items. But this weekend and before, we did see some concerns, right? Folks playing on basketball courts, folks playing on playground equipment. To address that, the city has put up caution tape on a number of playgrounds, and in terms of how we enforce further, the Kansas City Police Department will be increasing patrols in our parks. We also encourage folks, if you have heard about house parties or any other types of events that seem to exceed the 10-person limit, to call the 311 line. So call 311. You'll be asking for a community interaction officer. So the police department will be doing follow-up in terms of if your neighbor has been throwing large house parties, or if there's been some business that has not been following the proper rules and regulations, call 311. We'll have a KCPD community interaction officer out to investigate thereafter. And the department itself is increasing patrols throughout our community. A few other notes that I wanted to address for you. Yesterday, we were certainly heartened to hear the president took the advice of medical experts and others that this crisis will last longer than beyond Easter Sunday, but will go to April the 30th. At this time, Kansas City is not extending its emergency order. However, we would note, as we do consistently, I talked to our health director, I talked to our director of EMS to review how long our order will need to stay in effect. My belief is likely that it will go through April 30th, and I think the reason that we're not saying an end date yet necessarily, an extended end date, is because we have some interest in making sure that we're not giving false hope to folks who may think that there is a magic date that comes and everything goes back to normal. The real standard for when things go back to normal, and at least the direction that we're getting from our health director and others, is this. One, when cases are no longer spreading widely in this community, that would mean that not only the rate of new cases is falling, but there are fewer unlinked cases. Right now, we still get a number of cases that happen. They seem to be somewhat random in some way. We don't always know the type of transmission. So we want to see the new case rate not just flatlining, but also falling before we change. We also would note that another factor of when things change is when the local health system itself is stronger. And what we mean by that is that it's clear that we can handle a sustained level of folks who are coming in for care, not just relating to COVID-19, but also the many other health conditions that affect our community. Another area that's going to be important for us is the time at which we actually have enough testing in this community. And I know this is something that we, mayors throughout the country, governors and others, continue to ask a great deal about, is when will we have adequate testing to make sure that we're actually getting a good snapshot on the number of infections and cases. Frankly, if we know what the level of community spread is, where is it spreading, and we can actually have better answers. Until we actually have those elements met, I would expect us to continue to look to a lot of our the steps that we've taken now to continue. I include in that our social distancing, business closures, etc. A few other questions have come to us different times. One is about inconsistency in terms of essential businesses versus not. I've got a very simple rule of thumb that usually has guided me when we've been asked questions in my office, when the health department's been asked at others, which is if you have to ask whether your business is essential or not, it likely is not. And one very simple point is this: essential does not mean valuable. I know that everyone's business, everyone's way of life is incredibly valuable, is incredibly important. But essential businesses really speak to those businesses that keep our communities open, right? That are actually taking care of folks, helping both communities survive and people survive. Really going to that level is the best way to address it. Over recent days, the health department has issued 200 letters already, that is 200, to businesses that need to comply with the order. We will continue to do that. Businesses that need to comply largely need to shut down. And so we have the health department acting, I think, impressively, because they're handling a number of other issues now in connection with this crisis, but to make sure those businesses are taking heed of the orders in our community right now. One other thing that I would note, and I noted this over the weekend, it's not lost on me that our neighbors in Kansas have issued a statewide order. I continue to wish for such a thing in the state of Missouri. Even though our Kansas City area counties are subject to that order, we recognize that there is significant community spread, and it doesn't stop at the Jackson County line. It doesn't stop at the Cass County line. What we need is actually a concerted effort, I think, throughout the state of Missouri. We continue to address that to the governor. I know the health director and his peers throughout the state of Missouri, and frankly his peers throughout the country, have talked about stay-at-home orders, their level of importance, and we continue to believe that that's going to be key for us. In addition, providing more personal protective equipment, importantly not just for health workers, first responders, but also frankly for those in grocery stores, those who are dealing with the public at a significant extent. Right now we don't have enough masks, we don't have enough to actually protect a number of the people who are impacted. I've also been asked to answer a few questions that are listed for me, then I'll come back to questions for all of you. In terms of businesses that are having concerns at this time, who can you call? We've set up a special line at KC BizCare. You can call 816-513-1120. That's 513-1120 in connection with resources you may need to keep your business open to make sure the business itself is surviving. We have announced and passed at City Council a Small Business Emergency Relief Fund. We expect to announce more details about the Small Business Emergency Relief Fund on Tuesday or Wednesday of this week. We will first look to be providing loans to small local businesses, that will be Kansas City, Missouri businesses, with 20 or less employees. So 20 or fewer employees, and we'll look to address businesses that have been impacted by this order. We'll announce more details on that program midweek. We would look to have that fund itself set up and ready to help people next week. A few reminders for individuals. Bus service remains running in Kansas City. There are many in Kansas City who either work essential jobs or this is their only way to get food, healthcare, etc. So we continue to do that. In terms of zero fare transit, although the City Council has passed funding to help support that, we had not planned previously a rollout until the 1st of June. That might be even later this year, but we continue to have a number of routes, the Prospect Max Corridor, for example, where there are no fares required, but our bus service continues in Kansas City, and we will expect it to continue throughout the crisis. As you would note, we also have utilities that have suspended shutoffs, both KC Water at the direction of the city manager, but also a number of our other utilities have agreed to work with that. And then rent payments, in terms of rent, you still have to pay, but there won't be evictions in any of our Kansas City area counties, at least in which Kansas City sits. We'll note others actually often call our office in connection with unemployment insurance and questions. If you have questions on that or any of these issues, we encourage you to go to kcmo.gov/coronavirus. So a few other reminders that I want to note, and then I'll get out of the way for any questions, are this. Call 311 for most of your needs right now. If you think that there is someone down the street who has not been complying with the orders, if there are folks that are having large house parties that we've heard about, businesses that aren't in compliance, you can call 311. You should ask for a community interaction officer from the Kansas City Police Department. We have them in each of our patrol divisions. They will go out and investigate after the calls have been made. We've enhanced our patrols in the parks as well to make sure that people are complying with the orders. We also note that if you have any immediate health risk related questions, you can call the Health Department's Environmental Health Division at 816-513-6315. Again, that's 513-6315 if you have any emergency questions relating to environmental health issues, etc. And then my last area, and then I'll stop for any questions, and the doctors will be available for any questions as well. A number of folks have reached out to us to ask, what are we doing for the homeless population? What are we doing to make sure we're prepared if there is an outbreak in our unhoused community? A few different things that we're exploring now. The city has already spoken to a number of different hotels, apartment entities, and others to help create a situation for temporary housing in our community. We've been working with regional organizations, including the Continuum of Care for Homelessness in our region, to work not just in Kansas City, Missouri, but across state lines to make sure that we will have populations able to have a place to live if they're actually waiting for test results, if they're subject to quarantine, and so we're working on that. We also continue to work with our state and federal agencies in terms of creating extra hospital capacity in the event that we'll be needing that as well. We're proud to work with organizations like Restart, Hope and Faith Ministries, the Salvation Army, and others to make sure that we're ready when and if there is an outbreak in the homeless community. And as you may know, Kansas City, Missouri itself approved $250,000 of funding recently for Restart. As part of that, we are now asking them to make sure they're taking a leadership role in creating housing opportunities for those who may be subject to quarantine as we go through this crisis. With that, I'll be happy to answer any questions you might have.
Mayor, what do you say to folks that would say your call there to call non-essential businesses in and call people who are having house parties? A cynic would say that sounds a little Orwellian.
I don't believe it's Orwellian at all. It's a public safety issue. I am a lawyer, by the way, and where local government power is at its greatest is when you're talking about police powers to keep the public safe and healthy. The health director has extensive authority to try to make sure we stay safe. Largely everything that I'm doing is in consultation with our medical directors and medical staff. And here's the deal. We are not trying to eliminate anyone's normal way of life. There are other cities in this country that have issued curfews. We have not taken that step. There are other cities in this country that have done far more extreme steps, including even in this metro where you have the police actually enforcing a number of different orders. We've tried to make sure that we're being deferential as much as we can to the public, but one thing that we will be sure of is some of the very community spread concerns that we're trying to address don't occur. And so, it disappoints me when this weekend I was in Swope Park and saw that there were probably 50 kids around a basketball game, the kids that are playing, and then there are folks that are standing around. And I understand that it's warm outside. These are things that people want to do, but there's a reason that we're going through these steps now. It's to keep those kids safe, to keep their parents, their grandparents, and so many others safe. I don't think it's Orwellian in the slightest. Instead, I think we've followed and gone through extensive study in connection with other cities in our metro, cities in the Midwest, and throughout the country to make sure we're following orders that are clearly constitutional, but also ones that are narrowly tailored to support public safety.
Can you characterize what level of compliance you feel that you're getting from businesses and individuals?
Yeah, in terms of compliance, I think by and large, I've seen that most Kansas Cityans are complying with the orders. And I think there are a few ways you can see that as an example. Rare is it that we actually get to have a press conference here and you see almost no cars go down 12th Street during our entire conversation. I've been proud of Kansas City businesses and businesses from throughout our region that I think have complied with these orders, recognizing that there is significant change. Indeed, that's why we worked so hard to pass our Small Business Emergency Relief Fund as quickly as we were, because there have been businesses large and small that said that we're going to do our part to make sure we're closing down. So restaurants, barbershops, so many others that are following these orders. And I think we hear about the exceptions and sometimes the bad actors, but I've been very proud, and I would say 90% of Kansas City businesses, and I know just from my interactions and what I see online, I'm not going to these businesses, but what I hear is that everybody is largely complying with these orders, and I think they're doing it to keep communities safe.
Have you been disappointed by the governor's decision not to issue a statewide safe order?
I wouldn't say disappointment. The governor's got a big job, and I'm not the governor of Missouri, but I certainly think that Missouri would be better off with a statewide stay-at-home order. We've seen tragic deaths now in a number of different counties, not just in Jackson, St. Louis County, and St. Louis City. And had a death yesterday in Henry County, or this weekend. And so I think we will continue to see spread. And the other concern that I have is this. In the same way that the virus has impacted communities at different points, right? A few weeks ago, we didn't see the huge outbreak that we're seeing, for example, now in New Orleans. I have a significant concern, not just for Kansas City, where I'm mayor, but also throughout the state of Missouri, that if we don't take these aggressive steps now, you will see that sort of impact in communities large and small throughout Missouri. And I know much of the answer that the governor has had over time has been that, places in the state are different. Kansas City is different than Poplar Bluff. But frankly, I think Kansas answers that point too. Overland Park is different than Goodland, Kansas, or Colby. But at the same time, we see that there is some need for consistent rules throughout our states. And so I would argue right now that I think it is an important public health and public safety point. I think I've expressed that point previously to the governor. And I see that things have changed with this crisis, and I hope they'll reevaluate. I know they have a daily press conference, and so I hope they take that opportunity.
And I know you've talked to him about this. What has he said to you about his decision not to?
You know, I think right now he has a view that the state is different and is dealing with the impacts of this in different ways. And I understand that will be his view. I guess my greatest concern is keeping Kansas Cityans safe. I happen to know that somebody who drives into Kansas City from an hour and a half or 2 hours away, right? And some people just come in for work, for example, to do that sort of stuff. A lot of our construction sites, for example, the KCI Airport, we're drawing on a workforce that is not just from Kansas City, Missouri. Indeed, only 3% of it was from Kansas City a few months ago. And so therefore, I think the sign is that this virus is fluid, just like humans are. And so I think we do want to make sure that every step that we can possibly take to limit community spread will be an important one.
Mayor, you constantly referred people to 311. Many Kansas Cities will say they have lots of experiences of 311 not being responsive. Has there been any changes to make sure that people get a prompt response?
Well, you know, we have the city manager out here, and I know he has done a great job in terms of making sure they're more responsive. We have an assistant to the city manager, Gene Lawson, who has been in every important meeting about this crisis. And so I'm confident that 311 is ready and able to handle the volume of calls that we're receiving in connection with coronavirus and the spread of COVID-19. You know, I think the city and our city workers are doing impressive and frankly outstanding work right now and trying to address many of the problems that we've had during the coronavirus phase. And so I'd be confident directing anyone to call 311 now to try to have the answers that they need. I mean, the important thing is this. If you're having different issues, don't call 911, right? Call 311 in connection with that house party. Call 311 with the park issue. Call 311 with business issues. We are making sure that our staff is ready to handle it, and I'm confident that we will be in such a position.
I have a really quick question, just to kind of wrap up how people are doing in Kansas City. If you had to give us a grade right now,
right,
how are we doing, and what is it that we need to really work on the most right now?
You know, I think that when we talk about flattening the curve, social distancing, following a lot of the orders that exist right now, are the way that we are addressing this. And so we have to continue to do that. But, you know, I've been impressed by the people of Kansas City. I saw some grade the other day that was a C. I guess I'm a lighter grader, and I would give us a solid B right now. I mean, I think when you look at some areas, there are still crowds that build up. I would like to see that diminish. I actually drove by a bar where the patio was still seemingly open yesterday. That's less than ideal. And I know that we're social animals, but at the same time, we need to make sure that we're actually adhering to these orders, because the only way we actually get through this is by making sure that we're maintaining social distancing and we're following the orders. And I don't bring up New Orleans accidentally. I mean, it's a huge tourist town, but the amazing thing is that metro area is, I think, a little smaller than ours. And to have thousands of cases right now is overloading their healthcare systems, overloading basic services. It's having this negative impact on lots of things. What I do not want to see is the same situation in Kansas City. And so, in some ways, we may be lucky that we're geographically based and that we didn't see the huge early spike. But all of these steps we're taking now are vital. And I mean that even on the world's most beautiful day, right? Everybody's going to be encouraged to go to the same space, but don't, right? Try to find a way to get somewhere else. Try to find a way to not violate a lot of our social distancing rules. And I will say this for our stores that are still open, our grocery stores and others, you know, I'd ask people to make sure they're maintaining space there. We do hear anecdotally lots of reports of how crowded certain either stores can get or lines can get. Even if the store hasn't put down spaces for you, it's like a fence size stores, but even if stores haven't put down that sort of space for you, just make sure you're maintaining it yourself, because that's, I think, a much better way for us to address it long term.
We are looking at this. Some of the commercial labs are still way too late in getting their samples back, and the cost in some cases is $300 or more per test. So we are evaluating that issue. The flip side of this is you also have to have the disease detectives to be able to monitor the positive cases to do that follow-up. And we're in the process of filling 10 positions, and we do know that we're getting money coming down from CDC to the state that will help support those positions. So we're gearing up for this, but we're not doing it right now. To kind of support and follow up what the mayor was saying, everybody has responsibility in the city to be helping us with this, because we're damaging some businesses through this action right now. And if people don't comply on the voluntary side and all these other settings, then we can't remove this as soon as we'd like to. So everybody needs to be enforcing this. It's the same thing with smoking. Right now, people self-enforce that. We don't have to go out and tell people not to smoke in these various places. People look at each other and self-enforce. So we're asking peer pressure. Now, don't do it violently, but just ask people to be practicing these social distancing components, because that's a critical part of our response. And yes, we hope the governor will support us. The health departments that 9 of us that cover basically half of the state's population have submitted a couple letters now to the governor requesting Missouri Hospital Association, the Missouri Family Physicians Group, Nurses Group. We've all come together on letters asking the governor to take this stand, because if we in Kansas City are doing the right thing, but others then aren't, they can come to our hospitals and take up our surge capacity. So we need to do this statewide.
How frustrated are you that the governor is not?
Frustrated. I am disappointed that he hasn't been able to do this yet. I know he's got a lot of other pressures. As we all know, whenever you put forth a new regulation or law or suggestion, if the majority of folks aren't already understanding it and willing to comply, it becomes a challenge. And in some of our rural areas right now, they haven't seen the death toll, they haven't seen the number of cases. So, I mean, I understand part of why he's struggling with this, but I also think that the issue where the president might have been pulling this back after 15 days probably had a factor, and the fact that that's been extended should help us. So we just hope that everybody will help the governor know that he's got the support from the people to do the right thing.
I agree and support both of the statements made by both Mayor and Dr. Archer. On the healthcare side, as the Region A medical director, I'm proud of our region. Every major hospital and agency comes together almost daily to discuss what our capacity is and what our response is. As a healthcare provider working in this right now, I can tell you guys that it is here, and the direction given by Dr. Archer and the mayor are both appropriate and necessary. So our region is listening and doing the right thing.
How is Kansas City doing in terms of bed capacity and ICU bed capacity?
It's a really good question. So the good news is we have a decade-long standing resource that we utilize here in the region to look at ICU beds, ventilators. It is slowly being adapted to look at COVID resources specifically. The good news overall is in hospitals across the board, the census is low, which means people have been listening to the mayor and the health director's statement to only go into the emergency department if you become extremely ill. That being said, we all feel on the healthcare side this is potentially the calm before the storm. We know that whenever we get the test results back, they're already a couple of days behind just because it takes time to get the test results back. And I can tell you anecdotally, after working in the COVID pod, it is here, and there are patients who are sick with us.
All right. Any other questions?
Yeah, Mayor, one for you. There was a recent survey by the Chamber of Commerce that said that more than half of the businesses in Kansas City feel like they're going to struggle to meet their obligations. Obviously, business is taking a hit here. But what do you think about that stat? And it was even higher than that among very small businesses.
Yep.
And all of them, sort of speaking to your point, were confused about what was and what is not an essential business. So I guess the question here is more than half of the businesses are worried about being able to pay their own bills, much less their work.
Right. I think we all recognize that this is going to be a significant time of struggle for us this spring and probably well through the summer. We are trying to do what we can at the local government level, but we recognize that we only have so much money, so much relief that we can provide. There are a few different ways that we can try to address this issue long term. One, I would like to see a quick and rapid deployment of the federal stimulus funds that come back to our communities. I had a conversation with my Congressman Emanuel Cleaver this weekend on that very issue. He's confident that we will have money back on the streets in Kansas City soon. I do hope that Kansas City, I know there's that 500,000 person rule. As I've noted, I think we're at 500,000 now, but if they're not counting that, I hope we can make whatever changes necessary to get the money as quick as possible. Why, you may ask? Well, because I don't want us to get tied up in Jefferson City and trying to actually get the funding to Kansas City. I don't think, frankly, the city of St. Louis needs that either. And so I hope that we can be as rapid in deployment of those types of stimulus dollars as rapid as we possibly can. Long term, I would call on all Kansas Cityans, everybody in the area, to try to support local businesses both during this time as much as possible, but also to be sure to do so afterwards. I've heard from wedding planners, for example, to say, don't cancel events, just postpone them all, right? Make sure that you're actually still having those types of events so people know that there are a stream of business opportunities thereafter. And so that's one of the best ways because, Michael, it isn't lost on me that a lot of our orders are closing businesses, particularly small businesses, in a number of areas of the city where, they can't handle it. It's one thing to be a law firm right now that's shut down. It's another to be a barbershop. Right? The law firm can keep doing a lot of stuff and all of that. The barbershop at 69th and Prospect doesn't have that same opportunity right now. And so we will look through both our relief dollars to do whatever we can to help people get by. But in the long term, we'll certainly look to find ways that we can try to stimulate businesses as much as possible, up to and including in our own procurement processes of the city, making sure we're using our SLBE program, but our small local business enterprises in even more situations.
So without more widespread testing, it's a little too early to say whether we are really totally flattening the curve. The rate of increase doesn't seem to be going up a lot right now in the Kansas City area, but we're going to have to monitor this carefully. I guess my closing comment to everybody is if you pretend that you already have this virus and could be spreading it to others, act in that way of staying away and social distancing. So most people don't have the virus yet, but if we all take that as our measure, notice that we're keeping our social distancing, washing hands a lot more often, all the things that everybody knows to do. Kansas City's have changed a lot of the culture already. I haven't seen a handshake in over a week, so we're doing good on some things, but the individual responsibility of slowing this thing down so we can get these small businesses back up and running, we've got to flatten this even more. Thank you.
Do you think that there are more coronavirus cases, Dr. Archer, in Kansas City that are not detected? That's your main concern.
Absolutely, there are more cases that we don't have detected yet. Remember, about half of folks can get this virus and not become ill enough that they end up seeking medical care. And we know that we've had community spread without being able to track down somebody else who was positive. So there's no question. That's why we have these additional stay-at-home measures. This is why I'm asking everybody to assume that you may already have the virus in a sense of being careful not to spread it to somebody else because you